Hi, and welcome to this yoga session for pelvic instability during pregnancy and beyond. Now, pelvic instability can refer to two major conditions. The first one is sacroiliac pain, which occurs when the two joints at the bottom of the spine that connect the sacrum to the pelvis in the back become unstable. This can cause pain that can be felt on one or both sides of your back, deep in the lower back, and can even radiate into the buttocks and down the back of the legs. Secondly, we have pubis symphysis dysfunction, where the joint in the front of the pelvis that keeps both pubic bones together is weakened. This can cause a dull ache or shooting pain in your vagina, the front of your pelvis, around your belly, and even on the inside of the thighs. Both conditions are very common during pregnancy because of the hormone relaxin, which softens the joints and ligaments of our body so our baby can grow and move through the pelvis during birth. At the same time, the surrounding muscles that support our pelvis also get weakened and stretched by either a growing uterus, bad posture, and sometimes hyperflexibility, which again causes instability and pain in the pelvic area. So in today's video, I'm going to show you a few stabilizing postures that will help to reduce the pain and strengthen the muscles that support our pelvis. All are suited during pregnancy as well as beyond. Just make sure that you have checked in with your doctor to clear you from movement, especially when you have severe pain or doubts about the cause of the pain. And also make sure you have read the safety guidelines below. Finally, make sure you have at least one yoga block or firm pillow nearby. And then we're going to start from the posture I'm seated in at the moment, which is a supported hero posture, by sitting on top of a bolster or firm pillow, making sure that our thighs are parallel and our hips in line. From there, we're going to place one hand on our belly and one hand on our heart and just close your eyes. And as always, taking a moment to turn our awareness inwards and checking in with our body and with our breath. And today we want to give particular attention to the pelvic area, lower back, thighs, any area where you might feel the pain. And I want you to take a deep breath all the way down towards your pelvis. And a long exhale out. And then continue with this deep breath, trying to send your breath in any area that feels painful, and then taking that long exhale, trying to release any pain, any strain. Now, while we're breathing here, I like to add a bit of explanation on how to correctly align our hips and what to avoid when we suffer from pelvic instability. So most important is always trying to keep your hips in the same line. When sitting, this means you should avoid crossing your legs or taking your legs wider than the hips. Instead, try to sit with your thighs parallel, knees pointing forward, just as we're doing right now. Then when you are standing, you want to keep your feet no further than hip distance apart with your feet parallel, making sure you equally distribute the weight into both feet. Here again, you want to avoid all poses that open the hips as well as deep lunges which put too much pressure on your pelvis. Further, when laying down, try to always lay on one side and use a small pillow between the knees for support. And finally, avoid any heavy lifting or any other movements that put strain on your pelvis. Now, that being said, let's take one more deep inhalation all the way down into the pelvis and one long breath out. Then with the next inhale, you want to lift your arms overhead, interlacing the hands, lengthening through the spine. Exhale, flowing onto the left side. Inhale, center. Exhale, opposite side. Inhale, center. Exhale, you want to twist over to the left side. Be very mindful not to put any strain on your belly if you're still pregnant. Inhale, arms go up. Exhale, twisting towards the opposite side. Just creating a bit of movement along the spine. Inhale again, arms flow up. Once more, interlacing the hands up, finding length. Exhale, relaxing the hands beside the body. Then from there, you want to gently slide away the bolster or the pillow. And we want to come to an all fours position. So here, try to keep your wrist underneath the shoulders and your knees again right under those hips, no further than hip distance apart. And then you want to grab a block and place it in between your upper thighs. And then you want to squeeze it so you can keep it into place while moving through the following posture. And this will internally rotate our pelvis as well as strengthen our abductor, those inner thigh muscles and other parts of the glutes. And then we're going to start from the neutral spine, inhaling here. And then with the exhale, you want to start rounding the spine into your cat movement. So inhaling, neutral spine. Exhale, once more rounding the spine, creating space in between the shoulder blades, moving your chin to chest. And then keep on flowing like this. So each inhale neutral, each exhale as you round the spine. And here we're creating some movement along the spine, which is excellent if we feel the pain into the lower back. But at the same time, we're also tilting our pelvis back and forth, which is very healthy to release any tension in that pelvic area and create balance. Then we also want to start engaging our deeper core muscles as well as our pelvic floor muscles with each exhale. So with each exhale, you want to draw your navel to spine, activating those deeper core muscles, and you want to squeeze the area in between your pubic bone and your tailbone, your pelvic floor muscles. This because both will support our pelvis, so strengthening them can help to improve the stability in the pelvis. So inhaling neutral spine, and when you exhale, you're rounding the spine, you're drawing your belly towards your navel, and you squeeze your pelvic floor muscles. And then you want to continue like this. So inhaling, neutral spine, exhale, engaging your core, engaging your pelvic floor. Inhale again, relax, neutral spine. Exhale, round the spine, engage those deeper core and pelvic floor muscles. And then coming to one last round. And from there, you want to gently remove the block, coming to sitting, taking a moment here, and just checking in with baby, taking a breath, and then you want to very carefully come to standing. So placing one foot on the mat, other foot on the mat, and then you want to come to stand in the center of your mat with your feet hip distance apart, and then we're just going to do a few hip circles to one side and towards the opposite side. And this is very useful to release the hips, to release any strain we are feeling in the hips in the lower back. And then you want to place a block in between the upper thighs again, taking a moment to find a good alignment when we're standing. So first of all, you gently want to tilt your pelvic backward, drawing your navel in, creating space in the lower back. And you also want to roll the shoulders away from the ear. So like this, we're having a nice neutral spine, neutral pelvis. And then from there, we're going to work on strengthening the thighs. So we're going to take a deep inhale with the exhale. You want to sit like on an imaginary chair, lifting the arms overhead. Inhale, arms go down, coming back out. Again, exhaling, sitting down into chair position. Inhaling back out. Now continue to flow like this with your breath. Each exhale, when you're sitting down, also try to engage your core muscles, squeeze your pelvic floor muscles, and squeeze the block in between the thighs. So we're really strengthening all those muscles that support our pelvis. It's also very healthy for the knees, but make sure that your knees are nicely pointing forward so they don't drop inwards. And then we're coming to one last round, and this last round we want to hold. So we're going to stay in our chair position, and here to protect your back, you can do the same thing, but then placing your back against the wall. So same alignment, your feet are nicely parallel, your knees are pointing forward, and then you want to lean against the wall, giving your back a break, and then you really focus on squeezing the block while you keep on breathing here. Again, you want to gently engage the pelvic floor. You want to draw your belly in and then gently coming out. Now from here again, we want to do a few more hip circles to both sides again to release any tension we might have created in the hips. And then from there, you want to walk towards the wall. So again, placing the block in between the thighs for that nice rotation. And then you want to gently step backwards. So you want to come to more or less a nice angle so you can really press your hands into the wall, and you want to find length to the spine. So this is very healthy to stretch the back of the thighs, to stretch the lower back. Super helpful to release the pain. But at the same time, we continue to strengthen those inner thighs, and we can keep that correct and safe alignment of our pelvis. So really breathing down here into your hips, into your pelvis, Keep on stretching through the spine. Go as deep as you feel comfortable here. And then gently, gently, again, calming out. Releasing the block. Now we're coming back to sitting on the mat. So again, very careful, one knee after the other, sitting back on your heels. And then you want to transfer to coming to lay on the back. So very careful here. You want to start by laying onto the side body. And then using the support of your forearms, you want to gently roll over and then coming to lay flat on the back and then stretching the back of the neck so it's nice and neutral. I'm keeping my feet hip distance apart and I make sure that my fingers can reach for my ankles. Again, placing the block in between the thighs, and like this we're setting up for our bridge posture. So inhaling and exhaling here. And then with the inhale, you want to start lifting the buttocks and the hips all the way up. Exhale, rolling back down, vertebra by vertebra. Inhale. Again, hips go up. Exhale as you roll down. Again, also engage your pelvic floor muscles, your deeper core muscles. Squeeze the block. Inhale up. Exhale, engage those deeper muscles and press your lower back into the mat. And then we continue to flow like this with our breath. Each inhale as we flow the hips up. Each exhale as we roll the buttocks back down. And like this, once more, we're strengthening all the supporting muscles for our pelvis, and we're gently rocking the pelvis up and down. On the next inhale, we want to hold just a few seconds. Keep on breathing here. Push your hips as high as you feel comfortable, and then gently, gently rolling back down. And then I'm gonna place the block and I'm gonna place it underneath the sacrum. So I'm gonna lift my hips up, placing my sacrum on the block. And then you take a moment to relax. You can place your hands on your belly, breathing down in the hips. And then I want to stretch out one leg. So I'm starting with my left leg, and this is to stretch out the front of the thighs and the hip flexors, because when these get too tight, they're also going to pull on our pelvis and they're going to create more instability. So we're going to take our time in this last posture to really allow those muscles to open up, to release and deeply relax. So you're going to send your breath all the way down into that left hip, making sure you don't feel any strain in your lower back. So the moment you start feeling uncomfortable, you can always come out a little bit earlier. Sending one last deep breath into that hip and then gently bending that left leg and then stretching out the right side. And same thing here. By taking time, allowing the muscles to release, to open up, deeply breathing into that right hip now. Having this side melt open and deeply release and relax. One last deep breath here. And then walking that right foot again flat on the mat. And then gently, gently lifting the buttocks up one more time and just gently rolling back down. Placing the block on one side. And then from there, we want to come to our final relaxation, our shavasana. So I'm going to roll onto my left side to get best blood flow, best oxygen for myself and my baby. And I'm going to take one pillow under my head and the other pillow in between the legs. And this is also very therapeutic when you suffer from hip instability, to always lay on one side and to keep a pillow in between these legs. And then you want to become comfortable here so you can lay still for the next couple of minutes, allowing your whole body to release allowing your mind to relax. Scan your body, release your mind, taking your time. If there's any leftover pain, you can deeply breathe into that space and releasing all leftover tension, just breathing it all out. And then I'm going to leave you here. If you'd like to get to know a bit more about pre or postnatal yoga in general, you can sign up for my free yoga guides below with lots of tips. And you can also find more about me and my different projects. So I'm thanking you for watching this video. Namaste.